Aspirin, a double-edged sword? Is this common pain reliever truly as harmless as it seems? Aspirin more than just a headache pill. Its multifaceted role in modern medicine, from cardiovascular health to anti-inflammatory properties, alongside a look at potential dangers and historical significance. How it works. Understanding the pharmacological mechanisms behind aspirin's effects. Its amazing benefits. Discovering the wide-ranging therapeutic applications and advantages of aspirin. Serious risks to watch out for. Identifying potential side effects, contraindications, and precautions associated with aspirin use. Understanding aspirin helps you make informed health decisions. Aspirin, a nonsteroidal anti-inflammatory drug. NSAID, nonsteroidal anti-inflammatory drug. NSAID, pain-relieving analgesic. Fever-reducing antipyretic. Anti-inflammatory pain relief. Aspirin acts as an analgesic by inhibiting the synthesis of prostaglandins, which are chemical mediators that sensitize nerve endings and contribute to the sensation of pain. Reducing fever. It helps lower body temperature during a fever by acting on the heat-regulating center of the brain, hypothalamus, to counteract the effects of pyrogens. Preventing blood clots. At low doses, aspirin irreversibly inhibits an enzyme in platelets, COX-1, preventing them from clumping together to form blood clots, crucial for preventing cardiovascular events like heart attacks and strokes. Mechanism of action overview. Aspirin functions by inhibiting key enzymes in the body that are responsible for mediating pain, fever, and inflammation. Targets cyclooxygenase, COX, enzymes. Aspirin irreversibly blocks COX-1 and COX-2 enzymes. Reduces prostaglandin synthesis. This inhibition leads to a decrease in the production of prostaglandins. Alleviates symptoms. Lower prostaglandin levels result in reduced inflammation, pain relief, and fever reduction. Antiplatelet effect. Aspirin also inhibits thromboxane A2 production, reducing platelet aggregation and preventing blood clots. The brain. Reduces pain and fever signals. Inflamed tissues. Alleviates inflammation. Blood platelets. Prevents blood clotting. Prostaglandins, the body's chemical messengers. Prostaglandins are key body chemicals. Aspirin works by inhibiting the production of prostaglandins. Prostaglandins are responsible for inflammation, pain, and fever. How aspirin reduces pain. Aspirin works by inhibiting the production of prostaglandins. Prostaglandins are chemicals in the body that signal pain. By blocking prostaglandins, aspirin reduces the pain signals sent to the brain. This results in a decreased perception of pain. How aspirin reduces fever. Hypothalamic regulation. Aspirin targets the hypothalamus, the brain's control center for body temperature. Prostaglandin inhibition. IT reduces fever by interfering with the production of prostaglandins, specifically PGE2. Mechanism of action. By inhibiting COX enzymes, aspirin decreases PGE2 synthesis in the hypothalamus, lowering the body's temperature set point. The anti-inflammatory effect reduces swelling and redness. Aspirin is effective in alleviating visible signs of inflammation. Calms inflammatory response. IT works by inhibiting the production of prostaglandins, which are key chemical mediators in the body's inflammatory process. Mechanism. By blocking the cyclooxygenase, COX, enzymes, aspirin disrupts the synthesis of prostaglandins, thereby dampening the inflammatory cascade. Impact on blood platelets. Reduced platelet stickiness. Aspirin irreversibly inhibits COX-1, reducing platelet stickiness. Thromboxane A2 prevention. This action prevents the production of thromboxane A2, a key platelet activator. Blood clot prevention. Reduced platelet aggregation is crucial for preventing the formation of dangerous blood clots. Preventing clots, a lifesaver. Reduced platelet stickiness. Inhibiting the aggregation of platelets is key to preventing the formation of dangerous blood clots. Cardiovascular protection. By preventing clot formation, this approach significantly reduces the risk of life-threatening events such as heart attacks and strokes. The aspirin effect on platelets. Long-lasting inhibition. The effect of aspirin on platelets persists for their entire lifespan. Significant impact. Even a small dose of aspirin can produce a substantial antiplatelet effect. How long does it last? Pain and fever relief is temporary. However, the anti-clotting effect can last for days. How it works: blocked prostaglandins reduces pain, fever, and inflammation. Affects platelets, prevents blood clots. Benefit 1. Pain relief. Effective for mild to moderate pain. Provides significant relief for common sources of discomfort. Addresses various ailments. Specifically beneficial for headaches, muscle aches, and toothaches. Improves quality of life. Enables patients to resume daily activities and enhances overall well-being. Reducing fever. Lowers high body temperatures. Helps to bring down elevated body temperatures. Provides comfort. Offers relief and comfort during illness. Anti-inflammatory benefits. Reduces swelling and stiffness. Alleviates common symptoms of inflammation. Beneficial for chronic conditions. Provides relief for conditions such as arthritis. Heart attack prevention. Low-dose aspirin is often recommended for individuals at high risk of heart attack. Benefit 5. Stroke prevention. Helps prevent ischemic strokes. Achieved by reducing clot formation. Benefit 6. Post-surgery recovery. Pain and inflammation management. Can help manage pain and inflammation after surgical procedures. Side effect: stomach upset. Aspirin can irritate the stomach lining, potentially leading to indigestion or heartburn. Why stomach upset? Prostaglandins are vital for protecting the stomach lining. They help maintain the mucosal barrier against acid. Blocking prostaglandin production, e.g., with NSAIDs, reduces this protective layer. This decreased protection makes the stomach more susceptible to irritation and upset. Side effect: bleeding risk. Due to its effect on platelets, aspirin increases the risk of bleeding, especially gastrointestinal bleeding. Why increased bleeding? Platelets are essential for stopping bleeding. They are a key component in forming blood clots. Reduced platelet stickiness hinders clot formation. When platelets are less able to adhere to each other and to the site of injury, the process of forming a stable clot is compromised. This impairment leads to increased bleeding. A less effective clot means that bleeding may continue for longer than usual or be more severe. Side effect: allergic reactions. Aspirin can cause allergic reactions in some individuals. Common symptoms includes rash, swelling, and difficulty breathing. Reye syndrome primarily affects children and teenagers recovering from viral infections. Overdose, danger ahead. Taking too much aspirin can be toxic. Seek immediate medical help. Nausea, vomiting, feeling sick to your stomach, and throwing up. Rapid breathing much faster than normal. Dizziness, feeling unsteady or like you might faint. Ringing in the ears, tinnitus. Hearing a persistent ringing or buzzing sound. Fever, confusion, seizures. These are critical indicators of a severe overdose requiring immediate medical attention. Coma, swelling in the brain. These represent the most advanced and dangerous stages of an overdose. Liver damage risk. High doses or chronic use can lead to liver strain and potential damage. Pediatric risk. Increased concern for children, particularly. Regarding Reye syndrome, how the liver is affected. The liver is responsible for processing medications, such as aspirin. Overloading the liver's metabolic capacity or direct toxicity can impair its normal function. Internal bleeding signs. Black, tarry stools. Indicates digested blood in the stool. Vomiting blood. May appear as fresh red blood or look like coffee grounds. Dosage. The key to safe and effective use. Always follow the recommended dosage. Do not exceed the amount prescribed or recommended. Take with food or milk. This can help reduce stomach upset. Do not combine with other NSAIDs. Combining with other NSAIDs can increase the risk of side effects. Increases risk of side effects. Mixing NSAIDs can lead to adverse health reactions. Avoid long-term self-medication. Refrain from using medication for extended periods without professional guidance. Consult doctor for chronic conditions. Seek professional medical advice for ongoing health issues. Who should avoid aspirin? Children and teenagers, particularly those recovering from viral infections due to the risk of rise syndrome. Individuals with gastrointestinal issues, people experiencing active ulcers or bleeding disorders should avoid aspirin. Those on anticoagulants, individuals taking blood thinning medications may face increased bleeding risks. Risk group, asthma patients. Aspirin can trigger asthma attacks in some individuals. Consult your doctor before use. Risk group, pregnant/breastfeeding. Generally not recommended. Discuss risks and benefits with your healthcare provider. Aspirin, a double-edged sword. Balancing potent benefits against potential risks requires careful consideration. Your health, your choice. Always consult your doctor and make informed decisions about your health. This video is for educational purposes only and does not replace professional medical advice.